You're welcome here once again. This is still Dr. Bimbola Onifade. In this lesson, I'm going to be addressing the subject how to avoid pregnancy loss. This is a big concern to every woman out there, and we're going to be dealing with it here. Especially those who have experienced pregnancy loss before might be worried when they get pregnant again because they don't want the same thing to happen. So I'm going to deal with it, and I'm going to show you how you can access further help. So early pregnancy loss is a very common occurrence. Study shows that between 10 and 20% of women with medically confirmed pregnancy, hence a miscarriage. So you don't know about it because people keep whatever challenge they have to themselves. 80% of this occurs within the first 12 weeks of pregnancy. Remember, I talked about first and second and third trimester. So the first 12 weeks of pregnancy actually correspond to the first trimester. So 80% of the pregnancy loss that happens in first trimester, the first 12 weeks. Then the risk of pregnancy drops as your pregnancy progresses. And most women have a lower risk of miscarriage by the time their pregnancy is confirmed. So even though most pregnancy usually confirmed in the first trimester, by the time your pregnancy is confirmed, the risk is even lower because many women actually have miscarriage that they don't even know that they have miscarriage. Probably they just think it's their period. So after 12 weeks, the risk of pregnancy loss drops to between 3% and 4%, while after 20 weeks, the risk is much lower. That's estimated as 1 in 160 people. So more than half of early pregnancy loss is due to abnormal chromosomes, and this is where we must talk a little. So if you look at this slide, what this is talking about is to reassure you that once you get past first trimester, miscarriage is almost impossible. That's just 1 out of 160 people. That's the rough estimate, and it might not even be. So there are some other things that can cause it after 20 weeks that can cause pregnancy loss, but we'll address all these things appropriately. So more than half of early pregnancy loss is due to abnormal chromosomes. Now, miscarriages from chromosome problems usually don't occur again in the future pregnancies. Remember, initially what I told you is that most of this pregnancy loss that happens in the first trimester, and up to 10 to 20% happens. And 80% of this is due to chromosomal problem. So usually, if you have suffered from early pregnancy loss, you can be sure that mostly it is from chromosomal problem. It might not be, but there is a very big chance. And the good thing about that is miscarriage from chromosomal problems usually don't occur again in future pregnancies. You see, in life we can never say never. You understand, medically speaking, but the chances are low for it to occur again in future pregnancies. So that should be reassuring if you have lost pregnancy before or if it happens. So a miscarriage from chromosomal problems is not genetic, so you don't need to worry about that. And the good news about that is that it would not usually reoccur over and again. So one more thing you need to note is that there is usually nothing that can be done about miscarriage that is due to chromosomal problem, because it is like a favor done for you. Now, if this does not happen, you probably will give birth to a baby that has serious anomaly. So sometimes the body recognizes this and the immune system fights for you to get rid of this particular pregnancy, and luckily it rarely occurs again. And it is not because you have a particular problem, it is not because you in person have a special problem. What you need to note is that the risk of chromosomal problems increases the older you are. So that's one thing you need to do. Complete your family cycle as early as possible if it is within your power. What I mean by if it is within your power is that some people decide to just delay themselves because of academic purpose, because of their personal pursuit. You don't want to drag it. By the time you're getting to 35, this problem, the chances of getting this problem increases. So you want to deal with it by taking prompt action. Now, one thing I now want to address is common causes of recurrent pregnancy loss. I must say that I'm not going to address this completely in this video because this is a complete program on its own. But like I said earlier on, pregnancy loss due to chromosomal problem usually don't reoccur. When you begin to have recurrent pregnancy loss, it's most likely not from chromosomal problem. So we need to see the common causes so that we can address exactly what is causing the recurrent pregnancy loss. And some of these common causes include hormonal problems that can be addressed. So, but if you don't address it, you won't be able to solve the problem. Then talk about some medical conditions, even everything in a medical condition. But what I mean by this medical condition, talk about things that are not particularly hormonal and are still significant. We'll talk extensively about this later on. Then problem with uterus can cause recurrent pregnancy loss as well. Then problem with cervix can cause that as well, and then so many other things that I'm still going to talk about. Infection can cause it. Anything that is into extreme can cause you to lose pregnancy, stress, and all of such. So you need to, we're going to balance all of these up, and that's the purpose for this program. But what you are seeing on this screen is extensive, and I've put this together into a separate program entirely. And what you need to do to be able to access this, especially if you have been suffering from recurrent pregnancy loss, that make sure you join the premium program, because this is going to come free for anyone that joins the premium program. It's extensive. I've already worked on this. It's very extensive, and I just want to give it away so that you can be able to solve this problem. But the condition is that you must be part of the premium program. You will see the link to join the premium program wherever you're watching this on our platform, or check around if you're not on our platform. That's gynecycle.com. gynecycle.com. You can go to gynecycle.com if you're not watching on the platform. gynecycle.com. You need to join the premium program. When you join the premium program, you're going to get this program that addresses how to resolve the problem of recurrent pregnancy loss. I'm going to deal with this hormonal problem and the rest extensively, and I'm going to tell you what you need to do for that, and it's going to be free. I'm giving it for you for free. That's if you join the premium program. So in the next lesson, I want to address a problem that usually leads to pregnancy loss as well, stillbirth especially, and that's what we call resource incompatibility. So please make sure you make it to the next lesson. It's a very crucial one. I'm going to tell you what to do to avoid this problem, to know if you are likely to get this problem and what to do to avoid it. It's entirely preventable. The problem it causes is entirely preventable. And I will see you in the next lesson. Thank you very much.